Good morning, everyone, and thank you for being here today. My name is Eileen Figueroa. I am the Director of Communications and Operations for Forward Latino. Buenos días a todos. Gracias por estar aquí en el día de hoy. Mi nombre es Eileen Figueroa. Soy la Directora de Comunicaciones y Operaciones de Forward Latino. At this time, we are all here today to launch a very important campaign in the Latino community, stressing the importance of everyone to being vaccinated. En este día estamos aquí para lanzar nuestra campaña para poder a la comunidad latina que se vacunen. Es muy urgente que lo hagamos. At this time, I would like to invite our National President of Forward Latino, Darryl Morin, to come to the podium. En este momento, nuestro Presidente Nacional, Darryl Morin, de Forward Latino.
Thank you for that, Eileen. I'm going to remove this for the remarks here today. So first off, good morning and welcome, everyone. My name is Darryl Morin. I serve as National President for Forward Latino. And I'd like to take this time really quick to thank Mexican Fiestal, the Wisconsin Hispanic Scholarship Foundation, for hosting us here today. Where are you, Teresa? There you are. Big round of applause. Mexican Fiesta is back this year. Right? Because we're doing things like getting vaccinated. So thank you very much for that, Teresa. I also want to say a very special thank you to Secretary Timberlake, Council Gomez, Assemblywoman Sylvia Ortiz-Veles, the representatives we have here from Senator Baldwin's office, Vanessa Llanas, Maria Kasperski from Gwen Moore's office, and all of our other dignitaries that we have here, and Ms. Groves from Governor Evers' office as well. Thank you, Nadia, for being here. As well as all the healthcare professionals that are standing behind me here, because this isn't about gossip. This isn't about conspiracy and innuendo. This is about science, and this is about keeping the residents of Wisconsin healthy and safe. Over this last year, our nation and our state has been impacted in ways we have not seen in a generation. And we all know a disproportionate percentage of that impact was felt by Wisconsin's Hispanic community. From challenges they faced in accessing quality health care and government assistance programs, to financial challenges, to the healthcare crisis, and in fact the loss of life that many Latinos families suffered here in the state because they're essential workers. It's important that everybody remembers that Wisconsin Latinos are working in our hospitals. They're working in our nursing homes. They're making sure we have food on our table by working in the fields, working in the meatpacking industry, and so much more. And many of those, sadly, paid with their lives for taking care of us. During the pandemic, it is important that we all remember what I just said on how Latinos have really worked for the people of Wisconsin and how they've really felt, the entire Latino community, the pain of this pandemic. Confirmed last week by the Kaiser Family Foundation, let me say that again. Confirmed last week by the Kaiser Family Foundation, Hispanics continue to trail nationally when it comes to getting vaccinated, despite their more than 2-to-1 willingness when compared to their non-minority counterparts to wanting to get vaccinated. That's correct. More than twice the amount of individuals, more than non-minorities throughout our country, want to get vaccinated, but have not been able to because of the barriers that exist. And that's one of the reasons we're launching this campaign today. But today, with the financial support provided by the Wisconsin Department of Health Services through the COVID-19 Community Outreach Grant Program, we are here today to announce Forward Latino's Por Mi Familia Get Vaccinated campaign. It is believed to be the largest public health statewide initiative led by a Hispanic nonprofit in Wisconsin's history. By the time July rolls around, we will have spent in excess of $115,000 in Wisconsin alone. And not in man hours. That's in purchased media time. That's in materials, etc. As the majority of all our operations are done by highly qualified and motivated volunteers. So with the support of Governor Evers and Secretary Timberlake, over the next 3 months, Forward Latino will be airing television and radio commercials in key time slots to encourage Hispanics from across the state to get vaccinated. This will be matched by advertising on social and print media, as we seek to inform every Latino across the state to the benefits of getting vaccinated. And in communities where we don't have partners, we will be hiring individuals and working with them and training them with our rapid response team to make sure that the information gets out in those Latino communities as well. So once again, none of this would be possible without the generous support of Governor Evers and Secretary Timberlake. And not only are we appreciative of this grant, but we're equally appreciative of the timely flow of information as well. Secretary Timberlake herself has been on numerous online meetings with myself and other members of community leaders throughout Wisconsin, making sure we get the timely information we need to share in our communities. I'd be remiss too if I didn't acknowledge the vast and huge contributions made by Senators Baldwin and Congresswoman Morin, who understand the lives that have been lost in Wisconsin due to this pandemic, who understand the economic hardship that are being felt by the families here, and for all their efforts as well in making sure that funding flows through to those who need it. So, with no more further ado, please join me in welcoming the Secretary for the Wisconsin Department of Health Services, Secretary Karen Timberlake.
Real-time, good COVID protocol here. All right, hang on one sec. Darryl, thank you so much for that warm welcome, and Eileen, thank you as well for having me here today. I really want to congratulate Forward Latino and all of its partners, as you can see from the coalition represented behind me, as well as many other organizations that Forward Latino connects with across the state. We were very pleased to receive an application for funding for the media campaign and the outreach campaign that Darryl spoke to and that you'll learn more about and see in just a moment. This is a key part for us of continuing the momentum that started in the middle of December and needs to continue until we have every person who is eligible and interested and willing to get the COVID vaccine having an opportunity to get vaccinated. So we know that we are making great progress, and we know that we still have more to do and some gaps to close. In round numbers, just since the middle of December, we have given more than 4.8 million doses of the COVID vaccine across the state of Wisconsin. And that is a tremendous accomplishment by our public health partners, our health system partners, our local government leaders, our pharmacies, and organizations like this one who have been working together to establish our network of vaccinators, to establish the systems at the state level so that we could take in all those vaccine orders and get them filled, by our federal partners who have made the vaccine available, and on and on. Out of that 4.8 million doses, we now have 2.1 million people across our state who are considered fully vaccinated, and we are well on our way to that level of community immunity that we are all striving for. But as Darryl noted, we won't be able to call this vaccine campaign a success until we have every person who is eligible and interested having an opportunity to get vaccinated, and we especially need to close the gaps that do remain in some of our communities of color as compared to our white communities. And that is why this effort by Forward Latino to reach people in a language they understand, through media outlets that are familiar with, organizations and logos that are trusted, this is one of 100 similar grants that we have made across the state of Wisconsin to really work on closing those gaps. So I think the main message I would leave your listeners and your viewers and your participants with today is the COVID-19 vaccine is safe. It is highly, highly effective at preventing the spread of this disease, at preventing any sort of serious illness or hospitalization or death for those who get vaccinated. It is available. We know that vaccine began in sort of short supply, and that created challenges for people in accessing it. We now have plenty of vaccine available at healthcare providers, at public health clinics, at pharmacies, in other places across our state. We are branching out to work with more employers, more nonprofits and community organizations, faith communities, to make sure that we can deliver vaccine literally right in people's neighborhoods, as close to home as we can possibly make it. And efforts like the one being led by Forward Latino to raise the visibility, to raise information, to raise awareness levels about, is the vaccine safe, where is it available, how do I get it? That's really the next key part of our overall effort. So Darryl, with that, I again will congratulate you on this excellent work and turn it back to you. Thank you.
Thank you so much, Secretary Timberlake, for your words. At this time, I would like to go ahead and introduce the Honorable Sylvia Ortiz-Veles, Assemblywoman, Wisconsin District 8.
Thank you. Good afternoon. I am so happy to see the efforts that we have all heard and we're continuing to hear today. Because even as a county supervisor, I have been monitoring the COVID spread in the Latino community in Milwaukee County, and we are ground zero. So this has been at the forefront of so many people, and I'm really happy to see these efforts today, because we know that less than 30% of Latinos in Wisconsin have been fully vaccinated. And I just want to take a moment, I'm going to keep my comments brief. I know that there's a lot of other speakers behind me. I really want to speak to the Latino community. So these comments are from my neighbors and the Latinos in our state. The goal is herd immunity. When enough individuals have protection, there are less affected people in our community. And the virus cannot continue to spread widely and infect others, our neighbors, our family, our friends, our grandmothers, our nephews, our nieces. The vaccine is being offered at no cost to anyone. And the vaccine will protect not only you, but other people. Please, I encourage you to take the advantage of these opportunities and help all of us return to our way of life. Thank you.
Thank you so much, Sylvia. At this time, it's my pleasure to introduce you, Consul Dante Gomez, Consul for Community Affairs, Consulate of Mexico.
Buenos días a todos. El Consulado de México, por mi conducto, felicita a la organización Forward Latino y a todas las organizaciones que integran este esfuerzo, que es un esfuerzo muy importante, porque hemos visto que en las comunidades latinas y mexicanas el índice de vacunación es muy bajo todavía. La capacidad de contagio entre la población latina sigue siendo muy alto, a pesar de que la población latina representa solo el 7.1% de la población total. Se ha infectado o se contagia en una proporción de 11.2%, a diferencia de la población afroamericana, que representa el 6.4% de la población total y solo significa el 7.2% de la población contagiada, y la población blanca, que representa el 80.9% del total de la población, solamente representa el 75.4% de la población contagiada. En contrapartida, mientras que la población en general se ha vacunado en 43.7%, entre los latinos solamente se han vacunado 28.5%. Esto es muy preocupante porque nos habla de que en las comunidades latinas hay desinformación, hay información que ha sido manipulada y que circula en redes sociales y que están inhibiendo que una gran cantidad de personas soliciten la vacuna. En el consulado comenzamos a aplicar vacunas con la colaboración de la ciudad, del Departamento de Salud de la ciudad de Milwaukee, y llegan muy poquitas personas. Las campañas se han intensificado, pero nos damos cuenta en encuestas que hacemos todos los días, que varias personas dicen que no se van a vacunar, pero no dan una explicación definida, simplemente por mitos, por temores que han escuchado en algunas redes sociales, y las personas se quedan con esa información. Por ello, el Consulado de México exhorta a los mexicanos, a las mexicanas y a la población latina en general a que se mantenga informada, a que no den por cierta la información que ven en WhatsApp o en Facebook o en alguna otra red social que no tenga el aval de información oficial, que no esté sustentada en la realidad. Hacemos un llamado a que la comunidad se informe de medios profesionales como los de ustedes, a que se informe de fuentes oficiales y a que no se dejen llevar por mitos o por temores infundados que circulan de parte de quienes, pues, por sus propias creencias no creen en las vacunas. Estas vacunas han sido probadas antes de salir al público. Hubo decenas de miles de pruebas y actualmente se han aplicado ya cientos de millones de vacunas en Estados Unidos y las reacciones han sido mínimas. Una vacuna que provocó, la vacuna de Johnson provocó algunas reacciones adversas, alergias sobre todo, que son naturales en cualquier tipo de medicamento. Sin embargo, estas reacciones solamente afectan a mujeres principalmente mayores de 50 años en una proporción de 0.0007%, es decir, es un riesgo mínimo para el universo total de mujeres mayores de 50 años. Personas menores de 50 años, hombres y mujeres, prácticamente no tienen este riesgo. Todos los medicamentos, por muy sencillos que sean, pueden implicar reacciones adversas para los organismos. Es el caso de las vacunas. Así que el Consulado de México invita a la comunidad latina a que se informe. Si no quiere vacunarse, está bien, pero que tomen una decisión informada, que tomen una decisión responsable y que sepan que no solamente es la salud del individuo. Ese individuo, si se quiere o no vacunar, también está tomando decisión por otras personas, porque al no vacunarse puede ser un portador activo del virus y contagiar a seres queridos, a familiares, amigos, a compañeros de trabajo. Muchas gracias y felicidades nuevamente a Darryl y a todos quienes conforman este esfuerzo tan importante.
Gracias, Consul Gomez. At this time, I would like to go ahead and read a statement from Senator Baldwin's office. Vanessa Llanas is here representing Senator Baldwin. Thank you, Vanessa, for being here with us. Thank you to Darryl and Forward Latino for your strong leadership and hard work on behalf of Wisconsin's Latino community. I've been proud to work with you all for many years, and I'm so encouraged to see this important public information campaign getting deployed throughout our state. We share the same goal in ensuring every Wisconsinite gets vaccinated as soon as possible, and it's our collective responsibility to educate those we serve and ensure they know that the COVID-19 vaccines are safe and effective at preventing sickness, severe illness, and death. I want everyone to know that right now, everyone ages 16 and older who lives, works, or attends school in Wisconsin is eligible for any of the COVID-19 vaccines. While as of this past Thursday, teens ages 12 to 15 are eligible to receive the Pfizer vaccine. Every eligible individual who needs a vaccine is able to get one, regardless of their immigration status. If you don't have any ID or insurance, you will not be turned away. So I encourage everyone to schedule an appointment for your shots. COVID-19 is a contagious virus that spreads from person to person, but the vaccine helps stop the spread. And the more people that are vaccinated, the more protected Wisconsin is from the virus. Thank you to Darryl and Forward Latino for taking on this important work and getting this information out to the community. So let's all do our part. Get vaccinated to protect yourself and your loved ones. Together, we are going to beat this deadly pandemic and all get back to normal. And that is from Jonathan Farrah, State Press Secretary, Senator Baldwin's office. And at this time, I would like to go ahead and introduce Maria Kasperski, representing U.S. Congresswoman Gwen Moore.
Good morning. I am Montejano Kasperski. I'm here on behalf of Congresswoman Gwen Moore. I would like to thank Darryl and Morin with Forward Latino for their hard work on launching the Por Mi Familia campaign. Congresswoman Moore asked me that I share this message with you. The greatest tool we have in ending this pandemic are COVID-19 vaccines. I am so thrilled to learn that Forward Latino will be investing in Spanish language television and radio commercials and other media to spread the word about getting vaccinated. The more people get vaccinated in our community, the better off we all are. At the federal level, I am proud to have brought money home to Milwaukee and Wisconsin to get shots in arms. We desperately needed this rescue package to help us move through this pandemic and support our state and local governments. Milwaukee received $406 million. I supported the American Rescue Plan, which brought $59 million in funding to support community health centers, including 5 health centers in Milwaukee, to assist with providing COVID-19 vaccines, testing, and treatment. These funds were a lifeline, but it will take all of us to get through this pandemic. Many of our Latinx brothers and sisters were on the front lines working during the pandemic and were made more vulnerable to COVID-19. Take advantage of the chance to have protection against this contagious virus. Please protect yourselves and your family and get vaccinated. These vaccines are free. Thank you.
Thank you, Maria. On behalf of Congresswoman Gwen Moore, at this time, it's my pleasure to introduce to you Dr. Yolo Diaz, board member with Casa, ALBA, Melanie in Green Bay.
Well, thank you for inviting me to be here and for being part of the campaign. As a healthcare representative, I can assure you that it has been very difficult for us to be under stress since this pandemic started. Everything has shifted. We have to prioritize all of a sudden how we're going to provide care for our patients. As many of the other people have said here, definitely the Latino community was impacted with very high numbers. In Green Bay, we were, the meat packing plant was one of the first workplaces that there was a big cluster of infections. We made national news that way, and that's not the way we like it to happen. The patients are very scared, they're very sick, and it has been really difficult to, as the council said, it's been very difficult to maintain people well informed of what the disease is, of how to diagnose it. So it's been a lot of work. There's a lot of doctors that are burned out. There's a lot of respiratory therapists that are burned out. But we're seeing the light at the end of the tunnel. And we are not alone. We have a vaccine, and as physicians, as healthcare workers, we know that that is the solution to get rid of this virus. But we also feel the support of the federal government, the state government, the local government, the public sector, the non-for-profits. Everybody is helping us to provide the vaccines. I have heard here that there's, and of course, we still have a lot of work to do, but it's really, I can see that the patients are having very easy access to the vaccine, and that is really important. And of course, our commitment right now is only providing the information, the right information. As I repeat the words that the consul said, please refer to information that comes from the CDC or from the American Board of Pediatrics in my case, or from the American Board of Internal Medicine. We're really trying to debunk all the conspiratory theories that we have, because on top of all the work that we have to do to take care of the patients, now we are dealing with vaccine hesitancy, and that's our biggest barrier right now. And only with compassionate information to those people that need to know what the vaccine is how we're gonna really get there. But again, that's something us as doctors, the scientists can do, and we are just being supported by all these wonderful people that are helping us to get the vaccines to our patients. And I do feel the effort and how easy it is, especially for our Latino communities, for our Latino patients to get those vaccines. So yes, get vaccinated is the only way, but we're almost on the finish line. It's not time to stop, it's time to keep moving forward. Thank you.
Thank you, Dr. Diaz. At this time via Zoom, I'm going to introduce Jennifer Estrada, the Executive Director for Crusaders for Justicia.
Good morning. Sorry I was unable to hear a lot of that, but at first I would like to thank the Wisconsin Department of Health, Governor Evers, Forward Latino, all the healthcare workers, and everybody involved in this very, very essential campaign for Mi Familia. I am the Executive Director of Crusaders Justicia, which is a nonprofit out of Northeast Wisconsin and Manitowoc. We target fundamental issues impacting our community, and when the COVID hit us like a hurricane, we sprung into action and have been serving families where we see that they were most impacted, which was on their table. We became a part of the Wisconsin Hunger Task Force, and with that, we have been able to serve over 3,500 families a week, most of them being Latino families. I think this is an extremely important campaign, not only for Wisconsin, but kind of to set precedents, as we know that most of resources here in Wisconsin are set by not only the census, but by involvement of other commodities, other programs in Wisconsin. And we know, especially serving the Latin immigrant population, that obviously those communities have been left out, those communities have been not depicted fairly, and are most times not getting the best and correct information. Even according to the 2016 Brown County Life Study, which is up here close to us in Green Bay, the general population consisted of only 8.3% of Hispanic families. And we can only assume that that number is much greater due to the 145.9% increase from 2000 to 2015. So I believe that what we're doing here is essential, it's important, and I think that in order to get that done is by using the organizations, the people that have been out there in the community. We know that there's a distrust when it comes to services, giving out information, vaccine, and so Crusaders of Justicia is committed to help Forward Latino, this campaign, which is extremely important to get the word out, to get as many people as we can vaccinated. Obviously, we're all building towards a stronger Wisconsin. I want to thank, obviously, again, Governor Evers for everything that he's doing for Wisconsin, and finally putting some importance on communities that have been left behind. We specialize in helping disenfranchised communities, and we are excited to be a part of this campaign, and we were going to utilize our food pop-up pantries that we have in 13 different cities every single week to push out information on how important it is to get the vaccine. I just think that the most important thing that we need to do is realize that using the trusted venues that are already built inside the communities is how we're going to get more people vaccinated. So I am proud to be part of this campaign and helping Forward Latino get as many Latinx individuals in our community vaccinated as possible. So unfortunately, we couldn't hear everything today, but we know that we're doing something work that's extremely important, and I think that only together we're going to get to the other side of this. And we are committed as part of the Federation of the Hunger Task Force. We have outreach to 72 counties, all 72 counties and 10 tribal nations. So we have the capacity to do this, and so I just thank everybody for being here today. I think this is an important campaign, and keep working hard. And I think, as we say here at Crusaders, Wisconsin strong. So thank you for listening to us all today. Thank you for pushing out the messaging, and we'll be out here still working.
Thank you so much for your words, Jennifer. At this time, I would like to introduce Teresa Mercado, the Executive Director for the Wisconsin Hispanic Scholarship Foundation. And Teresa, once again, thank you for hosting us today.
Good morning, everyone. Thank you Forward Latino, thank you, Darryl, for inviting us to be part of this important and vital campaign to raise the awareness of the importance of the COVID-19 vaccine. Without a doubt, the COVID-19 pandemic has changed our lives. Many from being seriously ill, having lost family members, job loss, not being able to see our loved ones, and not being able to have fun as we used to. The Latino community has been one of the communities most affected by the pandemic. Now is our time to change the statistics. In the statistics, the devastating effects of the pandemic in our community. We have the tools. We have the tools that can help us to change the data. We have the vaccine. For everybody that really wants to have the vaccine is available. We know that we have the data in our favor. The data supports the effectiveness and safety of the vaccine. Por favor, vacúnate. Please get the vaccine. Remember, now is our time. If you protect yourself, you protect everybody around you. And also, you will allow us to host your fiesta. Mexican fiesta.
Thank you, Teresa. And at this time, via Zoom, I am going to introduce Baltazar Santana, Executive Director for the Latino Academy of Workforce Development in Madison.
Good morning, everybody. This is the time to heal Wisconsin. Thank you, Wisconsin Department of Health, Governor Evers, Forward Wisconsin, and everybody involved. Good morning again. My name is Baltazar Santana, and I'm the Latino Academy Workforce Development Executive Director. A study by the University of Wisconsin Population Health Institute and Healthy Workers Work Group found that as of December 6, 2020, more than 412,000 Wisconsinites have tested positive for COVID-19, and 3,719 have died from the virus. The virus has unequitable impacts in the Black, Latinx community, Native American, and rural communities. Approximately 1 in 5 U.S. workers are being exposed to the virus at the workplace at least once per month, and 1 in 10 are being exposed at least once per week. In Wisconsin, there have been many outbreaks and cases in healthcare, education, food service, and production, manufacturing, and retail settings. It is now time to start healing Wisconsin, and this campaign is just a step in the right direction. This campaign is essential. Our essential workers need an opportunity to continue working. Our Latino community was one of the most hit communities in Wisconsin. We have an opportunity to heal our community por nuestras familias. It is time to put our essential workers first. Essential workers kept our economy strong during the pandemic. They were at the forefront of the pandemic. Now is their time. Now is the time for nuestras familias. The time to heal is here, and getting the vaccine is just a first step of healing. Por nuestras familias, I'm proud to be part of this campaign. And just because we do serve a large community who speaks Spanish, I'm just going to say this in Spanish. Este es el momento de curar a Wisconsin. Gracias, Departamento de Salud de Wisconsin, Gobernador Tony Evers, Forward Wisconsin y todos los involucrados. Mi nombre es Baltazar de Anda Santana. Soy el director ejecutivo de la Academia Latina de Desarrollo de la Fuerza Laboral. Un estudio realizado por el Instituto de Salud de la Población de la Universidad de Wisconsin y el Grupo de Trabajo de Trabajadores Saludables encontró que hasta el 6 de diciembre del 2020, más de 412,000 residentes de Wisconsin han dado positivo por COVID-19 y 3,719 han muerto a causa del virus. El virus ha tenido impactos desiguales en comunidades negras, latinas, nativas americanas y rurales. Aproximadamente 1 de cada 5 trabajadores estadounidenses está expuesto al virus en su lugar de trabajo al menos una vez al mes. Y 1 de cada 10 está expuesto al menos una vez a la semana. En Wisconsin ha habido muchos brotes y casos en los entornos de atención médica, educación, servicio y producción de alimentos, fabricación y venta minorista. Ahora es el momento de comenzar a sanar a Wisconsin. Y esta campaña es solo un paso en la dirección correcta. Esta campaña es fundamental. Nuestros trabajadores esenciales necesitan una oportunidad para seguir trabajando. Nuestra comunidad latina fue una de las comunidades más afectadas de Wisconsin. Tenemos la oportunidad de sanar nuestra comunidad por nuestras familias. Es hora de poner a nuestros trabajadores esenciales en primer lugar. Los trabajadores esenciales mantuvieron nuestra economía fuerte durante la pandemia. Estaban al frente de la pandemia. Ahora es su momento. Ahora es el momento por nuestras familias. Ha llegado el momento de sanar y vacunarse, y este es solo el primer paso para la sanación. Por nuestras familias. Estoy muy orgulloso de ser parte de esta campaña. Gracias.
So once again, we're honored to be partnering with so many organizations from throughout the state, many which are running their own outreach efforts in communities around Wisconsin. And that's really what Board Meeting Familia is about, trying to provide that umbrella coverage, make that huge media investment that it takes to cover the entire state in support of all their efforts as well. Now, standing up here in front of the lights and the cameras is the easy part, right? We know for the report that I referenced earlier from the Kaiser Family Foundation that there are barriers to Latinos getting the vaccine. Barriers such as concerns or people misinformation stating that you need to have a government ID or social security card to get vaccinated. That is false. We've actually been working directly with the federal virus task force, and I can tell you unequivocally that is false. Anybody 12 years old or older is eligible for the vaccine. It's free, it's effective, and it's safe, with over 263 million doses given in the US alone. So we encourage everyone to get out there, to get vaccinated. In addition, with the Secretary, the Governor, and others, we've been working with business to make sure that they clarify, that they train their personnel on the true regulations around this. I won't point at, and I'm doing it solely from Forward Latino. We worked with Walgreens to help further ensure vaccine equity in their program. Because on the form, originally, it asked for a driver's license or government ID. And I want to compliment them. In working with us, within days, they made the change to their process, and they retrained their employees at over 9,800 stores across the U.S. Now we're still working with other retail partners to get them to make those same changes. But these are the types of barriers that together we will overcome. Now this morning at 8 o'clock, we launched our first television commercial as part of the campaign, and it's my privilege to share it with all of you here today.
Nosotros sabemos que mantener a nuestra familia saludable y segura es lo que más nos importa.
Por eso es que estamos pidiéndole a todas nuestras familias que se vacunen contra el COVID-19.
Es segura, efectiva y es gratis para cualquier persona que tenga más de 12 años.
Sin ningún requisito de presentar seguro médico o algún documento.
Cuando alguien me pregunta por qué me vacuné, les diré por mi familia.
So we're going to have commercials running 5 days a week, 3 times, twice during prime time, for the next 3 months. To make sure that everything is vaccinated. I want to thank the people who are partners who participate in the video. Dr. Diaz, who's with us today. Let's give her a round of applause, Dr. Diaz. You saw Jennifer Estrada from Crusaders from Justicia up in Manitowoc. Thank you, Jennifer. Baltazar in Madison. And Dr. Romeo, who couldn't be with us today, but there is a representative from his organization that's been doing so much, especially right here in the Metro Milwaukee area. The 16th Community Health Centers, represented today by Chris Rosh. Thank you. And obviously we have a wonderful partner here from the UCC, the United Community Center as well. Thank you for coming. So with that being said, we'll now open it up to members of the credentialed media to ask any questions you may have.
For Secretary Timberlake, I'm sure a lot of families right now are navigating this latest CDC mask guideline recommendation. Children under the age of 12 still can't get the vaccine. What's the advice from DHS for families navigating this new territory, especially with major retailers like Target dropping the mask mandate?
Right, I think what's really important for people to understand is that the CDC guidance asks us to think about our own vaccination status. So if you are vaccinated, the CDC has opened up the opportunities for people to take off their mask, provided they can do that safely. Even with that said, there are certain settings, like healthcare settings and correctional settings, and any setting where a retailer may have a different policy, where we do ask that people respect those mask requirements. We also continue to encourage, and the CDC continues to encourage, mask wearing in schools, because children under 12 are not yet able to be fully vaccinated, and because children 12 to 15 have only been eligible for just a matter of days. If you are not vaccinated, you continue to be at risk of contracting this deadly virus and of spreading it to others. And so we ask that people who are not vaccinated first get vaccinated. Go to vaccines.gov to find a place to get a vaccine. And please continue to wear your mask to protect yourself and protect others.
Thank you, Secretary Timberlake. I'd like to add that I've spoken with a number of individuals who've gotten COVID and who had to go to the ER, who said, why didn't I just get vaccinated? In the next week or two, we'll be launching another commercial featuring a beloved person in Milwaukee's Latino community, Carmen Lerma, who contracted COVID and actually couldn't make it this morning because she's at the hospital right now getting treatment after her double lung transplant. that became a requirement following COVID. So this is deadly serious, and we're asking all those people out there who are going to point to the CDC guidelines to be honest with themselves as to whether they've gotten their complete dose of vaccine yet or not. So, okay. Any other questions?
One more for Secretary Timberlake. MPS schools are now launching these new clinics on site. Is that the hope that more children, that soon children will be able to get these vaccinations before the start of the next school year?
Correct, yeah, as the age of eligibility for the vaccine continues to come down, we want to make it as easy as possible for young adults and for their parents and their caretakers to get vaccinated. And so by bringing vaccine clinics to schools, by bringing them to workplaces, by bringing them to community organizations, churches, and other kinds of community settings, we just make it that much easier for everyone in our state to get this life-saving vaccine.
And then for Darryl, could you explain the name Familia? What was the idea by labeling this campaign Familia?
Well, we knew that if we were to be successful in our efforts, it needed to be something that was culturally relevant. We knew that we had to talk to family members who are fiercely committed to their families and demonstrate it every day by working hard, 1 or 2, in some cases 3 jobs, in sacrificing so that their children could have a better life than they did. We knew it was important, it needed to be a critical part of this narrative, that family be a part of this. And as the Secretary said before, you're not just getting vaccinated for yourself, you're getting vaccinated por mi familia. So I'll be the first one to say that the day after 12-year-olds and up were able to get vaccinated, I took my son. And he was a little bit hesitant, but he got the quick shot. He's like, what, that's it? And the nurse was like, yes. He's like, no, well, what's next? And she said, no, that's it. And he said, a 13-year-old boy, why doesn't everybody just do this? Think of the lives that could be saved. I think that's an important message for all of us. Any other questions?
I would like to add to your question that, as I told you before, I'm a pediatrician. And I spend a lot of my time, I decided that I have to make sure that the child is fine. And instead of saying he has to eat vegetables and milk, no, I turn around to the parent and say, are you gonna get vaccinated? And most of the times they say no, they have the misinformation. So I do take the time to explain to them. And sometimes I cannot break the myths, but as soon as I tell them, let's do it for the children. Let's do it because they do not know the way we were living. We need to live a better world for them. They change their mind and they go and make their appointment. So that's the Latino community. We know it, and that's the right way to do it because I've seen personally how they completely change their mind if I mention their kids.
Thank you, Dr. Diaz. Any other questions?
For the Secretary. How is it going so far vaccinating in 12, 15 years old?
It's going extremely well. So just since Wednesday, we have vaccinated almost 13,000 young people. My daughter is 16, so I think she would object to a 15-year-old being called a child. So I'll just say 12 to 15-year-olds, almost 13,000. And so that's evidence that we are able to connect people to vaccine, that there are people who understand how important this is to do for all the reasons all of us have spoken to, and we are very encouraged about this early, strong start, knowing that we have more work to do.
I also want to take a quick moment to acknowledge the work the Secretary has done, something I've been remiss not to mention here today. When we first spoke about the need to connect Latinos with correct information, the first thing she did was stand up a Wisconsin state hotline. If you speak English, if you speak Spanish, or if you speak Hmong, you can call this number and get truthful, accurate, factual information on the vaccine, get any question you have answered, and be directed to the closest vaccination site near you. So anyone can call 844-684-1064. Once again, 844-684-1064, and you can select to talk to someone in English, Spanish, or Hmong. So thank you for that, Secretary. Any other questions?
Other than false information and vaccine hesitancy, can you go into some of the other barriers that are keeping Latinos from being vaccinated?
So as confirmed by the Kaiser family report, there were 6 points there. But the largest ones were confusion and misinformation that said that individuals needed to have health insurance or a social security card or a government ID to get vaccinated. So those have been huge. We've actually spoken to people who went into a facility to get vaccinated and saw that was a requirement on the form and turned the form back in and said they changed their mind. So we know that is a huge barrier for a number of people in the community. We also have individuals who are fearful that if they take off from work to go get vaccinated, they'll suffer some kind of consequence. But conversely, they're equally concerned that if they get sick and have to stay home, that they won't have that job either. So that's one of the reasons we're working so closely with so many business associations, et cetera, to make sure that employees are granted an opportunity and time to go get vaccinated if they're large enough. We'll work with them to take a local, a portable vaccination site, or work with a vaccinator near them to set one up at their place of employment, et cetera. So there is no excuse for anyone who wants the vaccine, who's 12 years and older, not to be able to get it. It is their legal right, and that's the way the program is designed. So. Other questions? Okay, well, we'll be around for individual interviews afterwards. Thank you all once again for coming out today. And a huge round of applause to all of our coalition partners, the secretaries, the governor, the congresswoman, the